lower her level and attack the hips.
Oh, massive head kick, she's out!
For a seemingly harmless kick to the head, one might just assume that this is something simple. However, in reality, if you just pay closer attention to the kick here, you'd see that this person was hit right direct around here, which is a very sensitive area that usually undergoes bleeding. And stay tuned for us to tell you what this condition is and what actually happens. For anyone to understand what's going on, we should start with the anatomy, which is the basics of how structures are arranged in the body.
Boring!
Now imagine the skull as a tough helmet-like structure, covering the outside of your brain, the area shown here. And then just below the base of the skull, you just notice the dura mater, which is the outermost layer, right against the skull. Below the dura mater, and in that area specifically in your head, around the temporal region. The temporal region is the region just above your ear. That is where one of the most major arteries passes through, the middle meningeal artery. This artery is relatively close to the surface of the skull. When a forceful impact affects it, it is vulnerable to tearing and thus causes what's known as a hematoma. Arteries, unlike veins, carry a lot of pressure within them, particularly because they're moving from the force of the heart. The heart is the reason that arteries are filled with blood and the pressures are relatively high. So what actually happens in the brain is the following, is that the blood is moved from the heart down here up to the head through the carotids here. As a person presents with lucid interval. The lucid interval is nothing but a transient loss of consciousness that occurs with immediate regain of consciousness and then again loss of consciousness here, then nausea, vomiting. Now let's say this person who suffered the head trauma presents to the emergency room. Order a CT scan, and after a CT scan is done, you would notice this crescent shape towards this area, and you can see a schematic here that I've provided from a CT scan from a real patient. You can see it around here, okay? And this is what we call an epidural hematoma. The first step is referral to a neurosurgeon, which are the brain surgeons. And what they do is that they open a hole in the brain and they evacuate the fluid from there.
Good job.
What are the potential punishments and the sequelae of this? Coma and death could potentially happen. If you've liked the contents of this video, feel free to see our video here. And please like and subscribe for more contents such as this. Stay tuned with Dr. Muhammad Al-Matas.